Good morning, boys and girls. Nigel here again from Phoenix Rehab Physio Hand. My name is Nigel, and I'm going to share with you about a continuation of the series called Achilles Tendon Injury, because I injured my Achilles tendon 2 days before Chinese New Year 2026. So I'm sharing the series. It's an informational, educational series. It's not medical information. So if you need a recommendation for a foot and ankle doctor for your Achilles tendon, let me know. I'm happy to refer you to them to help assess your foot and ankle and your injured Achilles tendon, right? So today I want to talk about, it gives me the heebie-jeebies because I want to talk about Achilles tendon rupture, what surgery is and what physio is gonna do for you. And why it give me the heebie-jeebies is because I shared earlier before that when I was young, around 13 plus years old, I had a fall and my ligament went pop for my ACL, right? My anterior cruciate ligament. So when I'm talking about this surgery and this injury, it just gives me flashbacks. Because there's similar sounding words like pop and rupture in there that I don't wish on anybody. It's not a nice thing, but it does happen. So let's talk about it, right? So we have had many patients who have injured that Achilles tendon and ruptured it, right? So if you know someone or if you personally have recently ruptured your Achilles tendon, the big questions that patients usually comes to their mind, or they ask us therapists, like, it's like, Nigel, or it's physio so and so, do I need surgery? Okay, and now here's the truth of the matter: surgery or no surgery, both are options. Okay, you can consider. I will talk about surgery or no surgery in a while, but to preface this is that surgery or no surgery is just part of the story. It's the beginning part of the story of your Achilles tendon rupture journey, right? Mid-term, long-term outcome is what's more important is that how you do your tendon physio over the next 6 to 12 months. Yes, it does take a bit long because our Achilles tendon behind our heel, right, is a load-bearing tendon, and you use it all the time to carry yourself, to move about, to sports, to run after your children, pets, whatever. And I'm going to explain what really determines whether you return to sports and life or responsibilities strong, or you're gonna struggle with weakness or re-ruptures. Okay, so first let's talk about what is Achilles tendon rupture. So I spoke to you before. So the Achilles tendon, so the muscles at the back of this foot model, right? So the muscles up here below the knee, and then it comes to a big thick tendon that inserts into the calcaneus over here. Can you see? Okay, so it inserts this way, and this tendon over here, you can get injured by misstepping, landing wrongly. Landing wrongly, and you can rupture it during a sudden acceleration when your muscles pull too hard, or when you sprint, you jump or push off very explosively. So it can snap like that. People describe it as feeling like they got kicked from behind. You may hear a pop, you may lose push-off strength immediately, your leg may flop down immediately. When my ACL snapped, I felt a toop. I didn't hear a pop, mine is a toop. It's like with a raffia string. If you pull a string and then it's just something like that, you don't hear a pop, you hear a pop or something like that, right? Then there are two treatment options at a medical surgical level, right? So option number 1 on 2 is surgery or no surgery. Okay, conservatively, for people who don't want to do surgery, yeah, you can choose to not do surgery. But the only option for not doing surgery, there's criteria, right, is you must get it sorted out very quickly. Within less than 24 hours, you have to choose for non-surgery already. And then when you have the doctor treat you and case manage you all along the way, right? So for non-surgery, your leg will put in a functional rehab program, starting with a cast and a special walking boot, with your foot pointed down, so that your tendons there can join together. It's similar like how mallet fingers are treated as well. But mallet finger is easier because we can just rest the finger in a cast, in a splint. But with the feet, your force is going through it every day, every time. Even if you're putting your feet down a little bit, you still have to tiptoe a little bit or try to avoid but it happens right? And then we'll go through a early weight bearing and physiotherapy along the way. This boot that you wear for non-surgery or conservative Achilles tendon rupture treatment is typically worn for at least 8 weeks, right? And then we slowly bring your foot back to a neutral position as the tendon sticks together more and more. Full recovery for non-surgery conservative Achilles tendon rupture. What a long name, right? Takes about 4 to 6 months. It's kind of similar to surgical recovery, but full strength, full recovery takes up to 12 months because you got to build the capacity at the tendon level, at the tendon, at the soft tissue level, right? The good thing about conservative is that there's no surgery, there's less risk of infection, there's less risk of hitting your nerve and kind of feeling kind of weird. Like my ACL surgery, I still feel kind of weird at my knee. My sensation has dropped down a little bit. The recovery time is about the same-ish. And non-surgery or conservative is best for people who are very sedentary, very old, or with high surgery risk. Because some people who cannot take anesthesia or because they have complex medical conditions, right? But for me, I'm younger and I'm a bit more sporty. I'm an active lifestyle of young children. For people who are athletes, sporty, move around a lot, wants more certainty, right? So we usually recommend, or at least the orthopedic foot and ankle doctor will recommend to do surgery because we know that the edges and ends of the tendon that ruptured has been sewn together. There's a lot more structural stability, and there's no we hope that the ends will meet and stick with the conservative method. The doctors who go in will suture the ends of the snapped tendon together. Although the risks are there's higher infection because when the new incision at the skin, there's an open wound, right? So there's slightly high chance of infection. But usually, I feel and think that the pros of a surgery, getting you back to moving way earlier, fuller recovery, it offsets the cons in my opinion. And the return to movement is quite fast, I feel, a lot better in my opinion, right? So both surgery or non-surgery can work, but if you want certainty, you want quickness, go with surgery option. Okay, your choice, you choose. The key things, again, as I say, it's how your tendon is progressively loaded after the healing begins. After the injury, during the healing, after the healing begins, right? That's part 1. What is an Achilles rupture? Now, let's talk about part 2, where the biggest rehab mistake of Achilles tendon rupture management. Many people go wrong here, and I don't blame them, right? So, most people, 95% of people, they think that, okay, Nigel, my pain has gone down, means we have recovered, I have recovered, I don't need physio, I'm recovering well. But you must understand that, and I'm going to repeat this like a broken record, right? Pain reduction doesn't mean your tendon is ready for load. This doesn't mean it's ready for power. It doesn't mean it's ready for jumping. It means that you're on your path of recovering, and when pain goes down, means that you're improving at the stage 1. Phoenix recovery protocol, we have 4 stages. Managing pain, inflammation, and protecting the injury is only stage 1. So don't self-graduate, don't self-discharge at stage 1 when you say, oh, I have no more pain. Then we got to start moving into stage 2, right? Where you work on movement, motion. Again, I mentioned just now, our Achilles tendon is a big ass, super strong tendon. That is a load-bearing tendon. You jump, you walk, you stand, all need the Achilles tendon. So the keyword is load-bearing tendon. You don't suddenly go from injury, then suddenly, oh, normal already. No. You gotta build up your tendon's ability to load the tendon. If you don't progressively build your Achilles tendon injuries strength, deal with the stiffness or its capacity to hold bear load, you may walk fine-ish. But the moment you run, the moment you jump, the moment you turn, wrong angle, that's where more problems will start. Re-injuries, re-ruptures, all they start over there. Because patients self-discharge at stage 1 where pain drops, right? Now let's talk about part 3. What proper Achilles tendon rupture, post-surgery or conservatively must include, right? a proper Achilles rehab sessions, right, campaign will go through stages. Three stages. Why show for? Three, right? At the first stage, you got to protect the injury. Don't mess it up. Don't cause re-rupture or re-tear. So protect it, allow it to heal, and gently encourage very protected movements that won't re-rupture. Okay? At the completion of stage 1, once that's done, pain drop, there's less inflammation, less swelling, it's protected, it's still joined together to the tendon ends. Then we move towards stage 2. The second stage, this is where we restore ankle mobility, we restore ankle movement safely without re-rupturing. Not just suddenly, I need to go full range. No, we got to do it in stages, right? There's criteria based. You can't go from 0 to 100 in like 2 days. Okay, we do it safely as we build your range of motion to restore your movement for your ankle, right? Once your movement is great, it's much better, it's good. Now we talk about business, serious stuff. And the third stage is what you really need for normal life, or you really need for sports, right? This is where you need to rebuild your calf strength. Okay, progressively. You need to slowly increase your tendon strength progressively. You cannot just do double leg exercise and you're done. It's a lot about single leg strength. It's a lot about single tendon strength, right? As we focus on your single leg strength, your tendon loading, that's where you will start focusing on. You realize that, oh my gosh, my explosive strength is coming back. I have plyometric strength right now. And then we can go on towards sport specific loading. You want to go back to your pickleball. You want to go back to your badminton. You want to go back to your basketball, golf. You want to chase your pets or your kids or your grandkids. Yeah, let's get there. Okay, but it's in stages. It's criteria based stages of loading. And to answer patients who ask, can we go back to sports? Before we go back to sports, we have to look at things like, okay, is your injured calf side same or close to your non-injured calf strength side, right? Is there a big asymmetry, like one is 100 and one is 20? Now then, we can't, right? And are you able to do things like repeated single leg heel raise, full clean without losing stability, without pain? Can you tolerate hopping or controlled jumping, right? We cannot just go based on what you feel. Oh, no pain today, okay. We cannot go based on, oh, I feel confident. No. We need to know what your healing leg, healing tendon can actually do. Like really actual, right? Now, part 4, the key question. When can you run again after your Achilles tendon rupture, right? Very common question. Other than the surgery or no surgery, the next common question is that, hey, when can I run again? When can I sport again? Okay, answer is this. Broken record me again. It's not timeline based, it's not time based. Some people ask, oh, can I run at 3 months? Can I run at 8 weeks? Can I run at 4 months? And I acknowledge those questions, but I'm going to turn it around a little bit. The better question to consider and ask is that, has your tendon regained enough strength and load tolerance for running, standing, walking? If strength is significantly weaker on one side, which is your injured side typically, running too early or sporting too early really increases re-injury, re-rupture of your Achilles tendon. Really. Okay? So recovery post Achilles tendon rupture isn't about how many days, how many weeks, how many months that have passed. It's about whether your tissue can truly handle the demand and the load that goes through it or not, right? Okay, so in closing, Achilles rupture recovery isn't just about surgery. That's usually, I understand, but it isn't just about surgery. Choosing the right surgeon is very important. It's true. We are happy to have refer you to great foot and ankle doctors for Achilles tendon injuries or ruptures. But really, Achilles rupture recovery, surgery or not, it's truly about rebuilding the capacity of your tendon. It's a load-bearing tendon, so it's a very important big tendon. And pain going down is only just the beginning, truly. It's really the beginning. Through recovery of your Achilles structure, right, it means that you will manage the pain safely, bring back your full range of mobility, because without full range, you cannot truly have full strength. Without strength, you can have stability. Without stability, you can have much stamina, right? Because it's a chain of events that requires one before the other can come in. And then for that to come in, you then really can get your functional performance, your sports, your explosive power. And only at that can you go back to sports or life at full speed, full power, which I want you to have. So if you're unsure where you stand in your recovery right now, right, or you're going to have a surgery soon, or you're currently undergoing a program and you're like, kind of stagnant, stalling, not moving, okay, give us a call, WhatsApp us, get it assessed properly, right? Let's not guess, don't guess. We will help you to graduate, not just discharge. And that's all I have for you today. Hit me up in the next, in the comments below, or I see you in the next video. Bye. Stay safe.